Okay, and we should be live. Hi, everyone, and welcome back to another session with Dental Shadowers. I am happy to welcome today's guest, Dr. Frey, a general dentist with a background in public health who is currently practicing in San Diego, California. Dr. Frey, it's a pleasure to have you join us today. Feel free to take it away whenever you're ready.
All right, well, thank you so much for having me. Yeah, so this is just about general dentistry, right? And I'll present a case to you guys today of what I started, I would say a couple weeks ago, and then hopefully some tips and tricks for you guys, all pre-dents out there, just to kind of give you guys perspective, and also some things that I did when I was going through college and being in your shoes. So this is kind of like my journey. I graduated from Pacific Union College back in 2012. I had a BS in biology, and then I did my MPH at Loma Linda University School of Public Health, then got my dental degree at the dental school there. And then this past year in 2020, I did a residency program, Advanced Education in General Dentistry at NYU. So that's been kind of my journey. Since 2012 to 2020, 8 years of my life dedicated to getting to dentistry, right? So I just kind of wanted to talk to you guys a little bit about, you're probably all in college right now, and you're probably trying to get involved in certain things. So these are kind of the things that I did when I was in college. I was a lab assistant for biology, the basic biology series. I also was a lab assistant, and this is a teacher's assistant for microbiology, immunology, and a couple other labs as well. So I would kind of help in that. I did some cancer research at my college as well. I was involved in different clubs, the biology club, the Asian Student Association Club. I did some research at Stanford University School of Medicine, and then some mission trips as well to Cambodia that was kind of medically and dentally related too. So, I think the key thing really is to get a greater depth and kind of of knowledge of what kind of medicine you would want to go into, if it's just medicine itself or dentistry. But I highly encourage you all to be really well-rounded whenever you decide to go into any type of healthcare profession, because at the end of the day, we're treating people and not the disease. So this is just kind of a college summary, if you mind. And then during dental school, I was a student ambassador for this dental school itself. I sat on the diversity committee, and I was also part of the ASDA advocacy committee, where we advocated for dental students, but also for dentists as well, in Washington, DC, and also in Sacramento. And then for clinic, I was a pod leader, where I help kind of be the liaison between my group of 8 classmates and the faculty dentists. So I was kind of like the liaison between the two and kind of help coordinate certain things. So those are kind of the positions that I held during dental school. So currently I work at 2 offices. I work in New Image Dental in San Diego, California. And then I work at another office, Isabella Avenue in Coronado. They are both owned by a husband and wife. So I have the privilege of working at both offices. Currently, I am on the San Diego County Dental Society editorial board. I lecture at Loma Linda. I just did a lecture for them yesterday. And I was a previous council member, part of the California Dental Association's Judicial Council. And then these are kind of my academic memberships too. So just to kind of give you guys an idea of who I am, what kind of educational history, and also just some of the positions that I've held in the past. So this is San Diego, if you don't know. New Image is in kind of like where Mission Valley is. If you know where Mission Valley is in San Diego, it's kind of not in San Diego city, downtown proper, but kind of on the outskirts a little bit. And then Coronado Island, I get to drive this beautiful bridge every Tuesday and get to go to Isabella. So this is just kind of some of the pictures of the offices that we have. And then this is Isabella. It's kind of a boutique office in downtown Coronado. So these are the two offices that I get to work at. So I know one of the slides that you guys were asking me was kind of like, what's a typical day at an office? So at New Image, I work there Monday, Wednesday, Thursday, and Friday. Usually morning huddle starts at 6:45 in the morning. And we go over numbers, we go over patients that are on the schedule, and we try to find patients to do wellness scans on. And wellness scans are essentially, we use our CAD/CAM technology to kind of assess the patient's teeth and also their gums. And over time, we're able to collect that data and kind of compare between different years and see if any changes have happened. Then, of course, as a private practice and a small business, we always try to find a patient who we absolutely love and adore and ask them if they could write a review for us on Yelp or Google or whatever it may be. Our first patient starts at 7. Monday and Tuesdays, we are from 7 to 4. Wednesdays and Thursdays are 7 to 6. I take the later shift on Wednesdays and Thursdays. So my boss starts at 7, I start at 9, and then I close out the day at 6. And then Fridays are my half days where I just start at 8 to 12, and we see, mix of patients at that point. So what is general dentistry? I think, I think a lot of you guys may question what it is, but I'm pretty sure many of you are familiar with what is general dentistry and what we do. But I like to frame this as I am essentially your family medicine practitioner, right? I am your GP. And if I found that by framing it that way, because, everybody's quite familiar with the medical field and knowing that you have to go to your primary care first. And then from there, get referred to different places, right, to get treated. So I try to tell that to my patients. I say, hey, I am your family medicine practitioner and I'm the GP to take care of you. And I try to know as many general things as I can, right? A broad spectrum of diseases, a broad spectrum of treatment. I try to know as much as I can. If I can't do it or if I don't know, then I refer you out. So, if I am, you wouldn't be a general family medicine practitioner, wouldn't be, going in and cutting out tumors, right? That's something that a oncology specialist or a general surgeon would be doing, right? So that's why I would refer you to an oral surgeon, that type of thing. So by framing it that way, I've found that patients understand it a little bit better and kind of know what my role is as their primary care. So what are the most common chief concerns at New Image Dental? I know one of the slides is chief complaint. We say chief concern. Complaint just sounds like patients are complaining, and that's not kind of a, we don't want to make patients feel bad that they're saying. So we try to say, what's your concern? And it kind of varies. It kind of varies from general stuff like I have I want a cleaning or I have a little hole in my tooth to anywhere from like I want a whole new smile. So it varies as to what people come in with. But at the end of the day, we are a general practice office, and we welcome everyone to come, and we take a whole host of people, and then from there, if we don't know what's going on, then we kind of refer out to the necessary specialists. But we're essentially your dental home, right? So these two are my bosses. Dr. Scott's on my right and Dr. Leslie's on my left, and I work for both of them. But the procedures that we usually perform at both offices are a lot of restorative dentistry, so crowns, fillings, bridges, if need be, full mouth rehabilitation, implants as well, implant placements and restorations, some basic oral surgery, nothing crazy, but extractions, surgical extractions, bone grafting, some orthodontics as well, very simple ones. If they're too complicated or need some surgical, help, then we refer those out. But something that's very basic, that Invisalign or Sure Smile, which are just clear aligner therapies that can help with those. Removable and fixed prosthodontics as well, all for implants. They come in here and there, and those are cases that I haven't fully gone into yet, but that's something that my bosses work on a lot. And some minor periodontal surgeries, if it's like a minor crown lengthening procedure or some gingivectomies, those are some things that we do. So we like to call ourselves a modern dental practice. And what does it mean as a modern dental practice? So this is some things that I absolutely love to talk about because we are very tech driven. And this is some of the tools that we use to provide quality care for our patients. So we have a CAD/CAM technology. If you guys don't know this, this is by Dentsply Sirona. Just a little heads up to all of you guys, a disclosure. I forgot the disclosure slide, but I'm not paid by any of these companies to talk about them. So this is a non-biased type of reporting here. But so we have this type of system to kind of create crowns, implant crowns, bridges. On the far left here is our scanner. We scan everything, we design it, and then it gets sent over to the middle part, which is the prime mill that gets mills all that restorations out. And then the Speedfire that's on the right hand side is the mill or the oven to kind of crystallize the structure that we're trying to create. You know, I think a lot of offices are switching over to electric handpieces, but this is another technology too, electric handpieces. We don't use, rarely do we use the air-driven handpieces, everything is electric. So I know that I'm constantly putting the right amount of torque in it, the right amount of, I could control my RPMs whenever I do any procedures. So it's very predictable, it cuts really, really well. And I'm able to do my preparation design so much more efficiently and so much more predictably by having these electric handpieces. We also do salivary diagnostics as well for if patients, if we need to know, hey, what's going on in your mouth? I need to know what kind of bacteria that's going on in your mouth, whatever it may be, we do salivary diagnostics to kind of aid us in better treatment planning for our patients. So I like to say this is kind of like a blood work that we do for our patients. You don't go to your doctor to, they kind of look in and say, I think it's this, right? They go in and they get blood work done to kind of figure out what's going on. It's kind of a similar thing. It's the salivary, you just spin in a tube, we send it out for the required labs that we want to do. And then we get a report back to kind of provide us more information as to what's going on in the status of the patient's mouth. And then from there, we can kind of provide a comprehensive treatment plan for them. This is something I've played with a little bit, but this is another software. It's called InLab by Dentsply Sirona. That is kind of like a lab tech type of tool. So this is on the computer, and we're able to kind of use that to create restorations, and it's a very, very powerful software. But so we have that as well on top of the software that comes with the prime mill or prime scan. So this is just another adjunctive thing that we have to, if we have to, plan things or whatever, we have that software as well. In one of the other offices, the Coronado office, we have the iTero 5D. This is a intraoral scanner as well, but it is also a Invisalign scanner, and it's also a caries detection aid as well. It has what they call a NIRI technology or near infrared technology that you're able to kind of put the wand around the mouth. And if you look on that top right, that black and white photo, it actually shows us where there may be some interproximal or what we call in between the teeth cavities. And we're able to see that very, very clearly. So that's something that just came out, I would say probably last year, maybe end of last year that came out. And it's been very, very helpful in aiding in cavity detection, but also helping us do some Invisalign cases and showing some renderings and stuff for that. So that's a very powerful tool as well. We also do 3D printing as well at our office. So if we ever, if you've ever gone to a dental office and you might do some those nasty impressions that you take into your mouth, and it gets everywhere, and I can't do it. It just causes me to just gag, like I can't do it. But like this is a whole nother way of being able to print models out. You could print teeth out, you could print so many different things, right, with 3D printing now. So we have this too available. So whenever we do big cases, if we don't know what's going on when it comes to like mounting and knowing where it is in the face, we're able to scan the patient, send it over to the sprint array, print it out, and be able to just put it on a model and kind of figure out what we can do and kind of treatment plan from there. Airflow 1 by EMS. This is a cleaning system, so we don't really use the technology of the ultrasonic cleaning, that high frequency noise that probably many of us are used to. We still do that once in a while if there's a lot of buildup, but this is a airflow technology which kind of pushes out, uses a combination of powder and water, and it kind of cleans out all the biofilm that's in your teeth and really is able to push that good powder underneath your gums and kind of really clean everything out. I like to call this the Rolls Royce of cleaning. It's just so much more powerful. We're able to do so much of a better cleaning, and we're able to get rid of biofilm so well. Even around implants where we used to not be able to do that, we can't get it in with ultrasonics. You could probably put a plastic tip over it, but we don't really know if it's really cleaning it that well. But with this one, I could get in there with that airflow tip and really clean that implant surface, and it doesn't hurt it. It really cleans it really well. So this is another piece of technology that has helped us a lot in helping patients maintain their implants, but also clean out all the other biofilm that may be in their mouth as well. We have the Galileos, which is a CBCT. It's a cone beam CT scan. So we're able to use this for not only our panoramic x-rays, but we're able to use this for a CBCT 3D scanning. And I'll talk a little bit more about this. I'll talk to you about an implant case that I just worked on. And then, of course, this seems like very simple, but digital radiographs, right? We have digital radiographs that are able to give us an image very, very quickly. As soon as we take it, it reduces the exposure of radiation to our patients. Yeah, it's just a lot quicker for us to kind of review it. And I could zoom in and see things a lot easier too. So these are kind of the technologies that we have in our office, and it's been really helpful in providing quality care for our patients and using technology and leveraging essentially technology to provide quality care. So I'm going to talk a little bit about implant workflow a little bit, and this is just a very brief overview of it, but I just kind of wanted to share a case with you that I just recently worked on, and I'm still working on it, but just show you some pictures and what I did and how we planned it and stuff. So the key thing whenever you do implant placement is that it has to be restoratively driven. And what I mean by restoratively driven, it means that you don't want an implant sticking out somewhere completely off angled and then you have to try to put a tooth on it, right? You want to make sure that the implant is centrally located in a place where the tooth would go, right? Or else you may have issues later down the line. Mind you, my implant training is not very extensive yet. I'm still trying to get more training in this, but I remember in dental school, it was like pounded into our heads, like it has to be restoratively driven. If not, you're going to have issues. And that's kind of the key thing, right? Whenever you plan implant placement. The most important thing is that as soon as you place an implant, it really doesn't move. Like it's permanent, it's permanently fixed. So you can't move that. So that's why it's so important to really plan where you're going to place the implant and make sure that it is in the right, correct position prior to placement. So this is a case that I received. This patient came in to me for an emergency exam saying that, hey, I broke a tooth. What can I do about it? So this is kind of the demographics. She's around 40 years old, no health problems, no medications, ASA1, and she's been a patient for us probably over 5 years, probably even longer than that, but she broke number 29 and she was saying that she wanted to get it taken care of. No pain, it's been previously root canaled, and she had a previous crown on it. So this is kind of the photos. We took radiographs here and we took an intraoral photo of it as well. And I presented her a couple different options, right? So I said, hey, we could do an extraction and a bone graft and implant placement, or we could do a post and core and crown lengthening, kind of ish. Don't really know if that's really going to be good, and a crown, or we could just do the extraction. And as always, any type of treatment plan, you always have to give them the option of no treatment. Patients have the autonomy, right, of no treatment. If they decide they don't want any treatment, that is their prerogative. I'm not here to force treatment on them at all. we discussed about the risks, benefits, and alternatives for all these, options. And at the end of it, she said, you know what, I do want to go forward with the extraction and the bone graft and the implant placement. So, so we did it. So back in September of last year, we just did the extraction and the bone graft. And that's the tooth coming out. And I packed some bone in there. We put a membrane in there and I sutured her up. And then from that point forward, she was left to heal for that time being. There's various ways of approaching this case. I wanted to kind of go this way because, financial reasons, it's easier rather than just placing an implant. Sometimes it could be a little bit burdensome, and the patient actually wanted to go with the implant or the bone graft first prior to the implant placement. So I was like, that's whatever you want to do, my dear.
And how long does the how long
does
the healing process typically take after the graft, after the membrane?
Yeah, so usually it takes about 3 to 6 months to fully heal completely.
Right.
But that's the reason why for the bone grafting material to kind of get reabsorbed into the body and the body to put some bone back in. So it kind of takes time for that whole process to happen. So that's the post-op radiograph that we took, and then she was allowed to heal, but holidays came into play, and and so we decided, you know what, let's just wait, and we decided to place the implant in February, which gave us plenty of time for that bone to kind of to really heal and that soft tissue to really heal back and mature. So let's go back to the CBCT. So we took a CBCT the day of she came in for her emergency. So this is her panoramic x-ray. There's a lot of other things going on in her panoramic x-ray, which we have discussed too, but she only wanted to take care of that tooth for the time being. So this is kind of a virtual implant placement. We mapped out where the nerve is. That's the purple thing. That's where the inferior alveolar nerve is. And then we kind of figured out where we're going to place this implant, right? So it gives me an idea of, I could move up and down, side to side, in and out, all over every single direction to really see what's going on with other teeth. So which is great because she has a lot of other things going on too. So I could kind of map that out, but then also figure out where I wanted to place my implant. So then she came back in January again. We took another CBCT to just figure out how she's healing, how does the bone look, but then also just kind of figure out where, in relation, did I get enough grafting material in that place? So after we did the CBCT, we took a prime scan. We took a 3D impression of it. So this is her 3D impression. And then I designed this crown here to figure out where in relation to all her teeth should this crown be. So remember, it's all restoratively driven, right? So I need to figure out where the crown is going to be placed in order to know where I'm going to place the implant. And then from there, I imported that information over into the 3D software and I overlaid it. So now I'm able to see where exactly I'm going to have the crown in relation to the implant in relation to everything else. So it gives me so much more information of properly treating this. And I know that as soon as I place that implant, I know exactly where I'm going to place it. And then I know where the crown is supposed to be as soon as we are done with this whole case, right? From beginning to end. So everybody has different ways of placing implants, but I really like milled surgical guides. They're more precise. I could make sure that the implant is in the right correct location. I know that the angulation is correct. So if I go back here, as soon as I place all of this stuff, I exported this information out to a lab and they milled out a surgical guide for me. So at our office, we use the Trueba Mansard Guide 2 here. That's the implant system that we use. And this is just kind of an information about the implant length and what, diameter, tissue length, all this stuff. But this is kind of the sizing here for guided tissue surgery planning or guided surgery planning. So on the surgery day, we have different items here, right? We have the surgical guide that we have used from the CBCT information, overlaid with the prime scan, the digital impression, right? Overlaid that information, figured out where I want to place the implant, then sent that information over to a lab, and they milled out this guide for me, right? So I know exactly where that implant is supposed to be. And then I have, of course, my implant system, I have a healing abutment, I have my implant, and then I have my torque wrench. So this is not the system that it is, but this is a different system. But essentially what it is, it's essentially just drilling and kind of starting the drill sequence and kind of essentially opening up the diameter of the bone, right? You don't want to just go straight in and just open up the diameter completely, but it's just little by little osteotomies, just kind of opening up the diameter of the bone little by little until you get that diameter of the implant, and then you place the implant in. So that's essentially what we did. This is how the tissue looked, how the bone, the thickness of the bone looked as well. So this is just how it looked the day that we did the surgery. Then I did a tissue punch there. I missed a little at the beginning, so that's why you see that little cut on the distal side, or of that side of the where the cut is originally. And then from there, I placed the guide on top, right? And then I went in and out with different types of osteotomies. So then I would go back to my kit, get a different burr that's a little bit wider in diameter, put it in the handpiece, and same thing, put the guide back in, up and down, and you just slowly do that little by little until it's completely out. And then from there, that's the osteotomy, and then that's the implant. And we place the implant in. And then after that, then we could grab the torque wrench and we could kind of torque it in place of where we want it to be. And then we place the healing abutment. That's not the right healing abutment, so we switched it out, and that's the correct healing abutment. Then we took a radiograph afterwards. So it's a guided placement. I know exactly where it's going to be. I know how to, everything's, there's no thinking here, right? It's been all thought prior. So the day that I have to do the surgery, everything is just streamlined. I don't have to think about it. I just go one burr after another, or one osteotomy, implant burr, back and forth until I open up that diameter. And then from there, I'm able to place the implant in. So it's predictable, and it makes me less stressed on the day of the surgery. So then now we have to let the patient heal, right? Now we have to let the implant osteo integrate into the bone, and we have to wait that process heal. So, we just placed this literally a couple weeks ago. So now I need to wait for her to heal, probably for at least 3-4, we'll see how it is, probably at least 4 to 6 months. And then from there, we're able to put the crown on and then load that implant. So the next step really is, and I don't have a video of it, but the next step really is to have her come back until she's completely healed. We place a scan body on top of that tooth. We take a 3D impression of it, and then we design it, and we're able to create the crown for her. So this is just kind of a later process of the whole thing. But I hope it kind of gives you an idea, a very basic understanding of, really when it comes to implant planning, the key thing is it's all about, treatment planning ahead of time and planning it way ahead with, the CBCT scan, placing the virtual implant, and then, creating a predictable system for you. So then what essentially we would use the prime mill. So I'll show you a video of the prime mill. Oops, I don't know if it'll work. So this is the prime mill. And it's able to cut crowns out.
Unfortunately, it's not picking up the audio, but I imagine that the music is orchestrated with the visual. So
Yeah, it is. But so this is essentially the prime mill, and it does zirconia now, so you're able to do zirconia restorations. But
Right.
it's just a milling unit that you're able to use to mill out crowns, bridges, and I just want to kind of give you an idea of what it would be right afterwards. So I'm going to switch gears here and kind of go with like tips and tricks for pre-dents that I
Awesome.
think is important to think of. So we'll kind of transition from treatment and all that stuff and some of the things that may be more relevant to you guys. So I know this is a big slide, but I really, really, really want all of you to really love dentistry, because you really have to love it in order to, you have to be able to see that you could do it for the rest of your life. The only reason why I say this is that because it's an extremely large investment, right? Right now, schools vary from 250 to 500K, maybe even a little bit more, but it's projected to be over 750K. I don't know when you guys are going to be applying, but you really have to look at the numbers here, okay? And be okay with, taking on that big of debt burden. And make sure you do it because you love it. Don't think that you're going to do it because you're going to make a lot of money. Dentistry, there's been like a joke, I think, but I don't know how true it is, but a lot of people like to joke and say the golden age of dentistry is gone. Like that's like back in like the 90s, right? Like that's old, long time ago. So, but I don't know how true it is, but I really think that you should do anything in life, right? Whether it be dentistry or whatever profession you decide to go for, but do it because you love it, not because you're going to thinking that you're going to make a lot of money off of it, right? I am kind of biased here, but I really think you should be prepared to do a residency. As soon as you're done with any 4-year dental school, be prepared to do a advanced education or a GPR or whatever it may be in order to be competitive out in the real world. Dental school really just teaches you the basics of what you need to know. So it's really just the basic foundation. They just barely scratch the surface, but there's so much information out there. I mean, I'm out of dental school from 2019, and like the amount of information that I learn every day in this field is, there's just so much to know and so much to learn, and I love it. So I think you just really have to learn to love and be able to be a lifelong learner. And I think for college, while you're in college right now, really diversify your experience in the sense of like, remember, dentistry is a people profession at the end of the day. I tell this to a lot of D3s and D4s whenever I do lectures for dental students. I say, like, patients are not going to know if you did a filling really, really well, right? They're really not going to know if you did it well, but what they're always going to remember is how you made them feel. So it's a people profession, and it's really about connecting with your patient. So by diversifying your experience and learning about other cultures, other people, going to various places around the world, it's only going to allow you to just be more well-rounded and be able to connect with your patient. And so I highly encourage you to just really put yourself out there and just learn about people. Like if you know and learn about people and learn about, just be, other people's experiences, you will be able to connect with any person and any patient. If you haven't, I would say get involved with ASDA. It's the American Student Dental Association. They have a pre-dental group on there too. They have conferences, they have various things available for pre-dents. I highly suggest you get involved. I didn't get involved with it until I got into dental school, but I really think they have so many good resources for pre-dents. And I know one of my close friends, she's at UOP currently, but she was very much involved with ASDA during her pre-dent stage. And now she's like even more involved during her dental school stage. And it's just like, and the things that she's told me is just like, there's just so much information that could help you. So I think you really should take advantage of it. I don't know what the cost associated with it is, but it's just a great resource to have. I don't know, maybe we'll go into this. I don't know, we should, but I think COVID-19 in dentistry, it's changed a lot. And I think you guys have felt it for sure in your college experience, but this is kind of the things that we've seen just in dentistry in itself. Of course, you probably are aware that a lot of the dental offices were closed, right, at the beginning of the pandemic. And now a lot of dental offices or majority of them are open, but still they're kind of not allowing you to come and shadow just because of COVID and the nature of COVID. But what we've been seeing a lot is now one visit dentistry has been really, really big. So at our office, we try to use the CAD/CAM technology to increase case acceptance and of course profitability, but really just trying to maximize the time that the patient is in chair and minimize the amount of time they have to come back. So that's really what we've been trying to do. A lot of patients are stressed right now, so we see a lot of cracked teeth, TMJ issues, bruxism. Don't worry about the falling out teeth part, but there's been an article about maybe, if you got infected with COVID, it could be something to deal with falling, teeth, falling, I don't know what it is. I think there's still more research that need to go into it. Of course, there's been a PPE shortage, and now we're able to administer vaccines, at least in the state of California. I'm able to administer vaccines, and I was supposed to actually do it today, but UCSD shut down. So, but that's kind of what we've been able to do in light of this pandemic. So it's not really relevant to pre-dents per se, but just kind of giving an idea of what's been kind of going on in offices right now. Future of the dental profession is promising, ? We don't know. I think it's going to be really a challenge in the next couple of years, at least the class of 2020, 2021, 2022, just due to this pandemic, right? It's just going to be a challenge, and it's going to be hard to navigate. This was taken from the United States Department of Labor. If you look at the COVID occupational risk score and the median, I guess, the annual income, dentists are just like right up there, right? High risk, high pay. But I mean, we are in the mouth all the time, exposed to aerosols, exposed to a lot of things. So, we are, this is something that you have to take into consideration now with the pandemic. You have to adopt new practices. There's now temperature checks and COVID questionnaires now with, in offices, and even changing patients' perceptions and concerns and just adapting to it. We have a lot of patients that come in and they're concerned about COVID exposure at the dental office, and you have to reassure them about, what we've done in our office and, what kind of precautionary measures we've taken with all of our patients and even our staff, and just reassuring our patients that, we are even doing more cleanings than we've done before, right? Cleaning the office so much more thoroughly and so much more, even with like HEPA filtration systems and stuff, like all of that, we have to be able to communicate that over to our patients. Now a little bit more relevant to y'all, DAT preparations. I think a lot of you guys probably hear this all the time, but I use Course Saver. I don't know if you guys heard of it, but Course Saver really, really helped me a lot. They have a great PAT section, so I use that. Of course, practice whenever you have to take an exam. And what I have found, when I did my DATs was, this is like the first big test, right? Like this is the big one to get into dental school. But then as soon as you get into dental school, it's like you have tons of exams, tons of tests. And then you get your board exams. You have to take your boards and all these different things. So one thing that I have learned at the beginning of college, I would just get really caught up in my head and be like, you would put like A, and then later on you'd be like, oh, I think it's C, or you're like process of elimination, and then you'll like battle between the two. What I have found is that if you constantly expose yourself to the material, you just sometimes have to just trust your gut and just kind of go with it. Like your gut tends to be a little bit more aware of maybe subconscious things. I don't know what it is, but just trust your gut. Like if you think it's A, just go with A, okay? And just move on. I know college is very demanding and stuff, but remember to sleep. Like sleep is so important for memory and for performance, test performance. So remember to sleep. And then lastly is really, and this is something that I try to stress, is really try to collaborate and don't compete amongst each other. If one of your classmates is struggling or is, wanting to know, learn more about the DAT, whatever it may be, right? Like collaborate with each other and try to help each other get to that next level. And that's what I encourage you to do in college, but I also encourage you to do that in dental school as well, because by collaborating, you'll grow together. Competition is just never healthy. With dental school applications, I think it's smart be strategic in the sense that look at the cost of the school and also the cost of the living area as well. Because if you're planning to take out loans out, you're going to be responsible for the living expenses as well. So just be really smart and strategic about it. I would say also talk to alumni that went to the school that you're interested, just to get a feel of it. And also, they may have ideas of it. So if you know any alums from different schools, just ask them, hey, what was your dental school experience? Cast a wide net. It never hurts to apply a lot of places, but I think there's a balance between applying really, really like a humongous net and, in a certain area, right? And then of course, start your applications early. I think that's kind of a given, but sometimes you don't want things like recommendation letters to kind of be holding your whole application up. So start early, start compiling all of that early, ask those people that you want to get recommendations for early. That's just going to help expedite the process and kind of help you streamline, kind of like take the stress off of you, right? Whenever you're applying. Lastly, it's really about, dentistry is a healthcare profession, and we constantly give to our patients, and we give them everything that I can, or everything that we can, right? I mean, I give them my time, I give them, my patients, I give them everything because I really, really genuinely care for my patients, and I really do love them, and I really want them, to have the best health possible. But that takes a level of introspection as well. So I really encourage you to really think about these questions about, like, why do I want to be a dentist? Like, is it because of status? Is it because of finances? Is it parental pressure? Or my friends are all doing it, so that's why I want to fit in and I want to do it? Or is it just because I'm following my patient or my parents' footsteps, right? Like, you really want to do it because you love it, and do it because you just care genuinely for people. Dentistry is very hands oriented, right? Like, we deal with our hands all the time. So ask yourself this and be objective. Like, am I really good with my hands? Do I have really good hand-eye coordination? Am I going to be okay with having debt for a good amount of my life? Like, I am in a big amount of debt, but you have to ask yourself, am I going to be mentally okay with just knowing that I have that loan, for dental school? Mind you, it's a good debt, but like, am I good just from a mental health point of view, right? Am I okay having that over me? Would I be burned out from being in school too long, right? From college, that's 4 years. If you decide to do a post-bac or a master's, that's another year or two. Or if you go straight to dental school, that's another 4 years, right? Like, are you going to be okay with being in school that long? Am I going to be intimidated by the idea of being surrounded by other classmates that are just as or more than qualified than I am in dental school? Like, as soon as you get into dental school, you have this realization of like, oh my gosh, like, everybody's on the same level or above me, right? Like, mind you, I wasn't the top of the class. Like, there was no way. But like, you just have to be okay with, there are going to be people that are going to be smarter than you, that's going to know more than you, but hey, I'm okay with it. Because at the end of the day, it's my game that I play, and that's my journey. Am I going to be able to work in people's mouths every day? Like, are you going to be able to see saliva? Are you going to be okay seeing blood? Like, that's your job every day. So are you going to be okay? Are you not going to get queasy looking at it, right? I mean, these are things that you should ask. Am I compassionate, or am I passionate about dentistry? Am I empathetic? Am I connected to my patients, or can I be connected to my patients? Am I willing to continue to learn for the rest of my life? Like, continuing education, and dentistry is just the beginning of the journey. And I'm what I think Dental Nacho says, I'm a baby age dentist, right? I just graduated from dental school, legit 2019, right? But I have this hunger of wanting to learn more and know more. And are you going to be okay with that, just being able to just spend time and invest money into it? Dentistry is not a cheap profession to go into, but the CEs are just as not as cheap either. Am I willing to invest into my profession and into my my career in order to grow as an individual, as a practitioner, but also personally as well? And I like to pose this, like, if you didn't get paid to do it, would you still do it? Like, I love dentistry. Like, there's just so much about it that I I fall in love with it more and more as I go into work every single day. And if I didn't get paid to do it, I would be totally okay too, because I would still do it because it's something that I can like absolutely love. And I love helping people and getting connected with them and just, being there. I like to say I'm your coach in your oral health care, right? I love doing that. So, ask yourself these questions, because we kind of have to be a little bit introspective in order to be, in order to grow, but also in order to provide the best quality care, right? You have to just be able to do that for your patients. So that's it for my presentation. This is my contact information. My email's listed right there. My Instagram is listed right there. You guys are more than welcome to email me or contact me through Instagram. And I am more than willing to answer any of your questions. Or if I don't know, willing to send you to somebody who would know. So I'm here for you guys. I know this pandemic has created a little bit of a stumble in being able to shadow dentists, but I hope this presentation kind of provided some perspective, but also gave you a little bit of insight as to what dentists do and kind of the fun stuff that we get to do every day. So thank you guys, I appreciate it.
Yeah, no, thank you. Fantastic. That was incredibly resourceful. And we really appreciate your professional insight into, I guess, the value of being on the right side of the digital age, and also the value of being, socially conscious and culturally competent. And that was very sort of impactful. Thank you. So before we do conclude today's session, we have a number of questions that have been submitted by some of our viewers. And so the first one being, I noticed that you work 5 days a week, while typically the other dentists that present only work 3 to 4. How do you maintain this intense lifestyle while also teaching?
Wow, I didn't even think about it that way. I actually like for me, it's like I go to work. This is like, I tell everybody this. I go to work and I think I'm playing all day. Like legit. I think I'm just playing all day. I see patients, I do procedures, but it's like I get like, of course, by the end of the day, I'm tired and I'm exhausted, right. But like I go in every day just loving, like, oh my gosh, this patient's here. Oh, we got to do this. We got to do it. Like I play. That's the thing. I play. And then teaching for me is like it's like for me giving back. Like I have been so fortunate in so many different ways that, I think it's just a way to just spread the knowledge, and whatever little that I know, if I could help someone grow, personally or in their career, if I could just share a little bit of my tidbit, I am more than happy to do it. So yeah, I mean, 5 days a week. Yeah, I didn't think about it that way, but it's fun and games for me. So ask me maybe in another couple years, maybe I'll be burnt out. I don't know, but
we'll make sure to stay in touch. Yeah, absolutely.
Yeah, there you go.
And just sort of to segue off of that question. So a viewer submitted, how do you balance work life with life outside of work and sort of personal life?
Well, it just kind of blends. That's the thing. It really does. My work and my pleasure blend. So, I mean, of course, I love spending time with my friends. I love spending time with my family. But, like on my off days, like I'm on patients' charts, I'm reviewing things, right. I'm looking at things but this is fun to me. So I don't know if I'm completely like neurotic or just like completely bizarre, but for me, work and play are blended. So it really doesn't. It seems bizarre that it's just the same thing for me. So, but of course, like having a healthy lifestyle, eating correctly, right, having that social connections with other people and maintaining those relationships and friendships is important for sure. But I mean, I don't know how to answer that. I think it's just more of work and play just blend together, and whenever I hang out with my friends, I focus on that, right? When I'm here, I focus on this, right? But yeah, it just kind of blends together for me a little bit.
Interesting. Okay. And another question, this is sort of referring back to the slides that touched on some of the technology that is available in your practice. Did you work with some of these devices when you were in dental school? And in addition to that, do you think we will learn / use them in dental school in the near future?
So I worked with, I mean, this technology, they're slowly creeping into dental school, mind you.
Right.
I did work with a little bit of CEREC in dental school, but remember, dental school is all about the basics, right? So you need to know how to do the basics first in order to go to this technology, right? You need to know how to take an impression, right? Like let's just say that computer crashes, right? And I don't know, like you need to know how to take an impression. So if that computer crashes and I can't take a digital impression, you should be able to go back to analog, no problem. So dental school is going to give you a good foundation on analog, right? On learning how to do analog stuff. Because I mean, there's some days that technology works really well and some days technology doesn't work that great. So,
and so that foundation,
you'll get exposure. Yeah.
Yeah. And so that foundation will act as sort of the framework for your continuing education.
Yes. Yeah. But continuing education, there's a whole host of things for continuing education. Yeah.
Okay. And I guess another sort of segue question, was it easy being sort of accustomed and acclimating to using these devices?
It takes a little bit of time to get to know them. I would say for me, the prime scan is still something that I'm still learning. I got some exposure with dental school, but not too, like the technology continues to evolve and gets more powerful as time has gone, and you're able to do a lot more. So I still need to reference back and be able to like learn it and stuff. But as of like 3D printing, that's pretty straightforward. As of using the airflow, that's pretty straightforward. It's just more of like crown designs and knowing how to place your margins and all that stuff. That's a little bit something that I'm still learning on how to refine my skills on that.
Okay. And referring back to sort of your experience in dental school, how stressful was it and how did you deal with it?
Yeah, I mean, dental school was very stressful. I would have to say my first year out or first year in dental school, I was not doing well. I think I literally had clinical depression. I was stressed out all the time. I had high anxiety and it was tough. It definitely was. But then I had a great mentor at the school, and she was able to just provide me such insight and such wisdom that it was able to kind of shift my mentality and my mental focus. And from there, I was able to just thrive so much more. But yeah, dental school is extremely demanding and extremely stressful. I mean, you go to class from 8 to 3. Third and fourth year, you're in clinic from 8 to 5, and then on and off, like whatever, like that's how it was for me, right? But you eventually learn how to cope with it. And it's really about having close friends in dental school to kind of be able to vent out, right? With all the frustrations or all the angst that you may have, and kind of cope together with it. But, I would say, have a good core group during dental school. That was really important for me. I had a good group that we were able to, share things with each other, help each other out if we didn't understand a concept, and we were able to kind of grow together in that.
Right. We have a relatively diverse range of viewers that attend our sessions, but I think this question is pretty relevant to some of our pre-dental viewers. What do you do when you're sort of out of college and out of the loop? You may have taken a couple of gap years and you're wanting to apply for the upcoming cycle. Do you have any sort of recommendations or insights?
I did that, right? So
okay.
I finished college in 2012, and then I took a year off and I worked at Stanford for the year. And then I took another year to do my master's, and then I applied to dental school. So, or no, that's not correct. It's been so long. I think, well, anyways, I had a gap year between college and my master's, and then I had my master's and then my dental school. So, but I think like get more exposure in dentistry, right? Like make sure you know that this is the profession that you want to go into. I would say just have life experiences that you're able to talk about whenever you talk with admissions, because you know, at the end of the day, they're looking for healthcare providers, right, that are well diverse and well-rounded in their life experience to be able to connect with patients. So, you know, that year off, like dive into dentistry, try to shadow if you can in person. I know now it's kind of maybe a little bit of a challenge, but that's what I would do. And if you're like, you know what, I would maybe want to just pursue another degree, that's what I decided to do. I took that year and I just pursued another degree in public health, because that's something that I actually really do enjoy. And I did that. So, you know, you could always get another degree if you wanted to.
Awesome. And I guess one more question from one of our pre-dental viewers. What made you choose dentistry instead of, say, medicine or research or a different sort of discipline in healthcare?
I picked dentistry. So I started off back in junior high or high school. I actually shadowed a dental office. And at that point, I was absolutely like captivated with it. Just how the office flowed, how the dentist was able to just, you know, connect with his patients, and just the service that they were able to do for patients. I was just absolutely captivated with it. Medicine for me was, you know, the beauty of dentistry is that you have the luxury of tailoring your own schedule. You have the opportunity to sit down with patients and talk to them, right? And really connect with them. For me, I saw medicine as more of, it's just kind of impersonal, you know, unfortunately nowadays. So for me, I've always been captivated with dentistry since the beginning. And I think that also sparked with, I don't know if this may be aging me now, but I don't know, Extreme Makeover with, that was like a big show back then when I was in junior high. That was kind of fun to see, doing some big full mouth reconstruction and through the ABC or whatever, NBC or whatever TV broadcasting that was. But that was also another thing that I was like, oh my gosh, dentistry can really like transform people's lives, right?
Right.
And so that's kind of how I decided to go into it.
Awesome. Well, I think that's a pretty fitting end to an otherwise wonderful presentation, Dr. Frey. Thank you so much for taking the time out of your busy schedule. Unfortunately, that's all the time we do have for today. But I want to encourage all of our viewers to sort of reach out to Dr. Frey's social media platforms if you do have any questions. This was awesome. Thank you again, Doctor.
Yeah, thank you so much. Thanks for having me.
Absolutely. And just before we do conclude today's session, I do want to remind our viewers that the quiz should be posted in the live chat, and it can also be found in our Instagram bio. And on that note, we want to wish everyone a good evening. Thank you so much again, Dr. Frey.
Thank you.
All right, take care.